Hey guys, Dr. Sidhu here. I'm one of the optometrists who works for Warby Parker, and today I'm talking to you live from one of our Chicago locations. Today's episode covers eye floaters. What are they? How do we manage them? And are they an emergency or not? Let's get started. Eye floaters. We've all heard about them, and some of us have even experienced them. Surprisingly, this is a pretty common complaint that optometrists get from patients. Typically, the patient will come in and you're complaining about seeing those little dots floating around in your eyes. You try to look at it, you try to pinpoint it, it's hard to follow, but you know that it's there and it's really annoying. On the flip side, this can also be a pretty frightening experience for a patient, as it's the first time you're experiencing something unusual with your eyes and you're just kind of unsure of what's going on. So let's talk about them. So what are floaters? We have what's called a vitreous humor in the eye. It's located right behind the lens of the eye and hangs out back here. It actually makes up 80% of the eye and helps maintain the shape of it as well. Now, as time goes on, the vitreous, which has a gel-like or jelly-like consistency, undergoes a process called syneresis. Now, I'm throwing a lot of big words at you. All syneresis means is that the collagen in this vitreous begins to break down. As it breaks down, it causes little clumps to kind of float around in the eye. Now these clumps kind of float around, hang out, super benign, they don't cause any issues. What does happen though, is as light is entering the eye, it casts a shadow on the retina because of that jelly floating around in the eye. Now this shadow is that floater that you see when you're looking up at a blue sky or a white screen or kind of just hanging out. The nice thing is that the longer that you have floaters, the better your brain is at turning them off. Initially when the floater is there, your brain is like, whoa, what is this? What's going on? And you notice it as well. But as time goes on, your brain is going to be like, this isn't as important. We can turn it off. We don't have to be noticing it all the time. And you'll start to notice that that floater isn't there as often. So a common myth that I hear is that floaters only happen in older patients. Now, floaters are definitely a part of the natural aging process. However, they're common in patients who have higher minus prescriptions, patients who are more nearsighted, patients who have had recent eye trauma, and patients who have had recent eye surgery as well. As I was saying earlier, the nice thing about floaters is, over time, your brain will start to kind of turn them off and you'll notice them less. Also, over time, it's possible that gravity will take a hold of the floaters and they'll just gently fall to the bottom of the vitreous, moving out of the way for you so that you'll be able to see without having those annoying floaters in the way. So are floaters normal or are they an emergency? As I was just talking about earlier, floaters are a normal part of aging, and the older we are, the more likely we are to have floaters. However, there is a small chance that floaters can be a sign of an emergency as well. Let me explain why. So the vitreous humor that I was talking about earlier is encapsulated by something called the vitreous cortex. As time goes on, that vitreous cortex can slowly pull away from the retina, and this happens in everyone. However, it is possible that that vitreous cortex, as it's pulling away, can tug on the retina. What this can cause is it can cause weird light sensations in your field of vision, or almost flashes of light like somebody's taking a photo of you with the camera. If these start to happen, it is possible that a retinal tear or detachment can occur. Some other symptoms to look for are a large, sudden increase in size of floaters in your field of vision, or it almost looks like a curtain or veil is flapping over the vision. If any of these things happen, you should come in and see an eye doctor as soon as possible. They'll run a full dilated exam on you to check both the central and peripheral portions of the retina, just to make sure that there aren't any retinal changes associated with your symptoms. Thanks for listening, guys. I hope I helped clear up some myths or misunderstandings that you had about eye floaters, and you walk away with a greater understanding about them. If you ever need an eye exam or help from an optometrist, please hop into your nearest Warby Parker and we'd love to help you. If you have any questions or myths or misunderstandings you'd like debunked, please leave a comment down below in the comments section and we would love to make future videos for you. Otherwise, thank you so much for tuning in and I hope you guys have a great rest of your day.